Assalamu alaikum. I'm Dr. Mohammed Jalal Mohinuddin, working as a consultant orthopedics at Western Hospital, Lakdikapul. Today, I have a public talk which is very important, very informative, and will help uh, uh, even non-medical population to know what exactly the importance of vitamin D and how to generate it and recover it in the body. So, with this introduction, I'll start my talk. So, vitamin D. Overview of vitamin D. Vitamin D is a fat-soluble vitamin, influence intestinal absorption of calcium, magnesium, and phosphates. So, it is basically in two forms in human beings. One is vitamin D3, other is vitamin D2. Vitamin D3 is generated on the body or reach the body by consuming animal origin food, whereas vitamin D2 it get through the fungi, mushroom, and plants. So both of them are inactive form. This point is very important. So even vitamin D2 and D3, what we are getting by consuming the food, they are inactive, and when they enter in the body, they need to get activated by the chain of reaction so that they can work inside the body. So this diagram will tell you what vitamin D2. Vitamin D2, as I told, it is derived from plant sources, whereas vitamin D3 it is derived from animal sources. So, what is the importance of vitamin D? Why we are telling so much about vitamin D? Vitamin D is very important because it maintains the bone health. It is responsible for maintaining calcium and phosphate balance. It improves the immunity and improves the function of the cells. It helps in maintaining the muscle strength, mental strength, and it has some anti-tumor and antioxidant activity. It also have anti-inflammatory and anti-fibrotic activity, and play important role in mental and psychiatric health. And it also protect from cardiovascular issues and atherosclerosis in long term. So this is the diagram of vitamin D, how it is generated. As I told, we have vitamin D. Vitamin D generated in the body by two sources. One is by animal sources and plant sources. So most of the time, what we are consuming, it is precursor of vitamin D, that is inactive form. Very less amount is very active form, we directly act over the cell. But whatever we are consuming, it has to pass through the first step reaction, second step reaction, third step reaction to get activated. So whatever we are consuming, it is an inactive form. So how it is getting converted from inactive to active form? First reaction is in the presence of sun UVB radiations. They are helping it to convert it and partially activate the inactive vitamin D. Then in the liver, it gets further activated, and finally in the kidneys, it is activated fully to act on the cells. So almost whatever we are eating in the food, it has to pass through all this reaction. Okay, so this is very important. Whereas the plant source also has to pass through the same thing. Very less amount what we are consuming is the active form of vitamin D. So how much ever of vitamin D rich food you are consuming, it is necessary or mandatory that you sit in the sunlight for it to get activated. Otherwise, whatever you are consuming, it goes inactive. So how much is the daily requirement? So in the infants less than 1 year, it is around 400 international unit. 1 year to 70 years, it is 600 international unit. And when you crosses 70 years, it is 800 international unit. So what are the sources of vitamin D? Here the fish is cod fish. So cod liver oil contain maximum amount of vitamin D, which is rich source of vitamin D around 1300 international unit in 1 tablespoon. So you need to find out where it is available and you need to consume it and give it to growing children. And egg, liver, and milk, they are poor source of vitamin D. Egg and milk, they are rich source of calcium, which is very different from vitamin D, but it contain very less amount of vitamin D. Fruit and cereals, almost they contain negligible vitamin D. So if we are giving lot of milk, lot of egg, or lot of fruit to the children, it is inadequate source of vitamin D. So we need to have proper source of vitamin D and sunlight exposure for the whatever we are consuming to get activated. So sunlight exposure is very important. We have UVB radiation in sunlight, which activate the first reaction of vitamin D in the skin. Later on, this activated vitamin D enters into the liver, then in the kidney, and finally reach the cell. So, what is the time? Appropriate time is 10 a.m. to 3 p.m. And you need to sit about 30 minutes exposing your face, upper and lower limb. If some fair skin population or fair skin person is exposed to sunlight during this time for 30 minutes, he can generate 50,000 units of vitamin D. Sunscreen, if you apply with sun protecting factor of 8 or more, it blocks penetration of vitamin D through the skin. And even glass windows also, they won't allow UVB radiation to penetrate through it. So if you are sitting in the sunlight, but the light is passing through the glass, it is not an adequate form of vitamin D activation. So we have sometimes no false perception that we are going or moving in the sunlight or we are exposed to the sunlight. How can we develop vitamin D deficiency? So what are these common false perception? We sometimes know we open the curtain, but we won't open the glass doors of the window. So sunlight will pass through the glass doors, but it enters your body, but it won't allow UVB radiation. UVB radiation will not cross the mirror. So we feel that we are in sunlight, we are not exposed to the UVB radiation, which is responsible for vitamin D synthesis. So if you are in the sunlight, you need to have the direct without any barrier of mirror in between. And some most of the people know they wear burqa. So they move in and around the sunlight when they are going for job or something, but they cover whole body. They feel that they are exposed to the sunlight, but when they wear the weaves or burqa, it won't penetrate. And few people know they go move in sunlight with the open body also, but they apply sunscreen to protect the skin from sunburns. So this also will not allow UVB radiation to generate vitamin D. So what happens in vitamin D deficiency? In infants and neonates, it causes fits and seizures. In toddlers and adolescents, it causes rickets. Rickets in the form of either bow legs or knock knee. And in adults, it may cause osteomalacia and stress fracture. In old age, it may result in osteoporosis. In addition to that, it causes change in the mood. It causes loss of bone, muscle cramps, fatigue, bone and joints pain in all population. So, who can play important role is diagnosing the vitamin D deficiency at early stage? Teachers. Whenever children goes to the school after long holidays like 2 weeks, 3 weeks, mid summer break or after winter or summer break, the children teacher when they are seeing the new students coming, they always must check the legs whether they are bow legs or there is any knock knees present. Second thing is very important. They can ask the student to get up from the floor, sit on the floor and get up without using the support. If patient is using the support of hands, support of legs, support of elbow or support all over the body, then it's tell that there is some weakness or muscle weakness going in the body and possible causes vitamin D deficiency. So teachers, when they are seeing the kids at their school, they need to just check these two things. When they are students are standing in the assembly, check their legs. When the students are in the class and you feel something different in the school, you can do this test. Ask the patient to sit and then get up without using the support. So then once the patient is having vitamin D deficiency, some person is having vitamin D, it is likely that whole family may have vitamin D deficiency because they are exposed to the same environment, they are exposed to the same food, they wear almost similar type of clothing. So if one person of the family is having vitamin D, it's highly possible that all the family members are at high risk of developing it. So we need to treat each of them appropriately. So this is called as blanket treatment. All the family members are treated if one person is having vitamin D deficiency. Who are the family members? Sibling, mother, and grandparents. Father generally goes in sunlight, but you need to see whether he is also at risk. So, take home message of today's presentation is in modern era, anyone can get vitamin D deficiency. And vitamin D deficiency in children can cause knock knee and bow legs. Vitamin D is available in sunlight from 9 a.m. to 4 p.m. because UVB radiations are present at the time. Mushroom and cod liver oil is natural source of vitamin D. Other foods contain inactive form, won't work unless you are exposed to sunlight. Teachers can play in identifying the deficiency at early stage. They can check the leg in the assembly on regular basis for the knock knee and the bow legs and check how student is getting up when he made to sit. When patient returns to the school after long holidays. When individual has vitamin D deficiency, then whole family need to be evaluated if there is any necessity of treating the family. So thank you. Exposed to the sunlight, take care of yourself. We'll see you post and like, subscribe to my channel. Thank you.